Your neck is an important part of your spine and also the most mobile. Unfortunately, it is this mobility that makes your neck vulnerable to injury, particularly after a rear-end car accident. Hi, I'm Dr. Heather Murray, and as an emergency physician at Kingston General Hospital, I see large numbers of patients who've experienced whiplash as a result of a car accident.
Hi, I'm Scott Whitmore. I'm a physiotherapist at Physiotherapy on Bay in Toronto. I help whiplash patients recover from their injuries. Although the neck is very strong, the force of the crash may make your neck move past its normal range. If you've had an injury recently, there's a lot you can do to help get yourself back to feeling better.
This program will help you understand what has happened to your neck as a result of whiplash. It will provide you with information which we hope will speed up and maximize your recovery. Hi, Louise.
Hi, doctor.
I hear you've been in an accident.
Yes, I was.
How are you feeling?
I'm really stiff. My mobility is really poor. I can't move to the left or the right, and I'm getting these headaches.
So tell me about the accident.
Well, I was turning left into my driveway when I saw this car coming from behind. I knew he wasn't going to stop. He just smashed right behind me, and he hit me from behind.
Louise's accident is typical for whiplash. When she was hit from behind, the impact accelerated her body forward. Most of the body, forced forward, is supported by the seat. But the unsupported head is forced backwards on the neck until it hits the seat back or the head restraint. Then as the car halts, the head and neck fling forward until the chin touches the chest. You'll notice with a well-designed head restraint, the amount of movement of the head when forced backwards is limited. Having a good head restraint or a movable one in an upright position will not prevent whiplash, but it may offer some protection.
This is my friend Kate. Louise has a soft tissue injury to her neck. These are the bones of the neck that make up the top of the spinal column. These bones are supported by a system of joint capsules, ligaments, tendons, and muscles. These are the soft tissues injured when the neck is propelled back and forth through flexion and extension during an accident. Because of the injured soft tissues, you might be feeling what Louise is feeling. Headache to the side or back of the head, a generalized stiffness or soreness in the neck or shoulders. Serious injury to the neck, such as a fractured vertebrae, is very rare.
The soft tissue injury that you have in your neck is similar to the type of injury from other activities. A twisted ankle, a sprained wrist, a pulled muscle in your leg. And it will heal in the same manner. During the acute inflammatory phase, when your tissues are the most tender, the swelling will happen within the first 24 hours after the accident and can last up to 72 hours. The repair and regeneration phase starts at 72 hours and can last up to 6 weeks. During this phase, your symptoms will reduce over time.
Now, Louise, you can expect to feel some discomfort over the next 2 or 3 days, but that should get better over 2 to 3 weeks. Use ice on your neck rather than heat for the first couple of days, and take some pain medications to help your neck feel better.
It's during the early inflammatory phase of healing that ice should be used on your neck. Try a Ziploc bag of ice with water for 15 minutes at a time, every couple of hours if needed. Use ice as well after doing the exercises we'll be showing you later. It's also in this phase that you may begin to take pain medication. Once you move into the repair and regeneration phase, you may start to use heat on your neck. A hot shower or water bottle may make it easier for you to move. You may also find during this later phase your need to take pain medication will decrease.
You may not be feeling any symptoms right now. It's normal for pain to get worse in the 2 or 3 days following an injury. Different people experience different levels of pain, and you can't tell how severe your injury is just from the pain that you're feeling. The most important thing is that you're comfortable enough to keep moving. Over-the-counter pain relievers like ibuprofen or aspirin can help make you feel better and keep your neck moving. Some people require stronger medication that your doctor may prescribe. If you need stronger medication, talk to your doctor. The most important thing is that you're getting enough rest and that you keep your neck moving.
That's good. Keep it up. There are a lot of misperceptions about whiplash. Serious injury is very rare. Commonly, whiplash patients will return to their place of work within 2 weeks, but it is all up to you. Hey, Carl, show me that new exercise I gave you. That's good. Your injuries are self-limiting. That means that it's up to you to get yourself back to your previous level of activity. Rest is an important component, but it should be combined with exercise to help keep your neck moving. As soon as the soft tissue in your neck becomes injured, fibrous scar tissue begins to grow around and infiltrate it. This is good because it means your neck is repairing itself, but fibrous scar tissue is very stiff. Left alone, it will make it harder and harder for you to move your neck, so to keep those tissues flexible, you have to keep moving. Movement forces the scar tissue to become more compliant so the injured soft tissues can heal properly.
Doctor, what about this neck collar? Would that help me get better?
Most people don't need a neck collar to help them get better. The most important thing for you to get better is to keep your neck moving. Neck collars inhibit the motion of your neck and don't allow the movement that your neck needs to get better. Unless your doctor has specifically given you a collar, I would take pain medication and keep your neck moving.
It's been only 1 day since Louise's accident. Most people like Louise are able to go back to work immediately if they're at non-strenuous jobs. An early return to normal activity, including work, will reduce your symptoms and improve your recovery.
How does it feel, Louise?
Feels okay, but I'm still conscious of some stiffness around my neck. And I'm not sure how long I'll be able to sit in this chair.
Louise has adopted a posture which is typical of motor vehicle accident patients. Good posture is very important. It helps to decrease fatigue and soreness and allow the tissues to heal in an optimum position. Louise, I would like you just to sit up a little straighter so that we can get a small arch in your low back. If you find this position is difficult to hold, we can use a rolled towel and we'll place it in the small of your back. This will allow you to get your head upright over top of your neck and over your shoulders.
I feel great. I feel much more upright. What about when I'm on the phone? I have to tilt my head.
To decrease the stress on the soft tissue structures, it would be best to use a speakerphone, or you can use a headset like this one. Now, let's stand up, Louise. It's very important to remember to have good posture while you're standing too. To do this, I want you to stand up straight so that your head comes to rest over top of your shoulders. If you're going to be standing for a long period of time, it'll be less tiring to put your foot up on something.
Like when I'm at the photocopier, I can put my foot up on some stacks of paper.
That's right. Now at home, it's important to remember to have good posture too.
A lot of chairs at home are extra cushy and don't support you properly. Sit in the firmer ones, and again, use a rolled-up towel to support your lower back. Sleeping also requires good posture. It's important that your spine remains in alignment while sleeping. The number of pillows you require depends on your sleeping position. If you sleep on your side, use 1 or 2 pillows or even a rolled-up towel, such that your neck is in line with the rest of your body. You can also put a pillow between your knees if that's comfortable. If you sleep on your back, you will probably only need 1 pillow under your head to support your spine in an aligned position. Try not to sleep on your stomach, because it will cause more discomfort. Have a good sleep, Louise. Your mending tissues do need rest.
Not only do you need to be aware of your posture, but some of your normal work activities may need to be modified. For instance, you should take a lot of breaks, get up, and move around. You'll also need to be very conscious of your movements, like opening a filing drawer so as not to strain yourself any further. As we mentioned earlier in this program, it is very important to keep the soft tissues of the neck moving so that they can heal properly. We've designed a few exercises for Louise to do to increase the movement of her neck and speed up her recovery. Hi, Louise.
Hi.
Hi. We're going to show you some exercises that will help stretch your neck and increase the movement. Now, in the beginning, because you've just had your accident, it's important for you to do these lying down either on the bed or on the floor. When you do these exercises, you can bring it to the point of pain or stretch, but not past. Okay?
Mm-hmm.
The first exercise that we're going to do is called a chin tuck. And what I want you to do is you're going to take your chin to the center of your neck, hold it for a second, and then you're going to release back to the start position. Okay?
Mm-hmm.
So let's just see you start to tuck that chin. Good. and relax. Now when you do that, you may feel like you strain some of the muscles along the front of your neck here, or you might feel a bit of a stretching sensation in the back. Let's try that one more time. And relax. Was that comfortable?
It's fine.
Good. The second exercise that we're going to do is called head rotation. And what I would like you to do, Louise, is try and take your head and just turn it towards the left or the right side of your body to the point of discomfort. You may feel a bit of stretching over on the left side, or you may feel a bit of discomfort on the right side of your neck. And come back. Good. And then I want you to come towards the left side now. Good. And back to the center. Any problems there?
No.
No. Good. Now, because the muscles of the neck also attach to the shoulder, it's a good idea for us to keep the shoulders moving as well. So what I would like you to do for that is to keep the arms straight, and then you're going to lift your arms up towards the ceiling. Good. You can let me know if you get any discomfort.
A little now.
Little now. Okay,
Now.
we're going to let your arms come back down. And then I'm going to have you show me where the discomfort was.
There was some pulling in my neck
Pulling in your neck. Did any of it go into the shoulder?
and slightly into the shoulder as well.
Good. That is perfectly normal to have those sensations. I would like you to, when you do this exercise, just go to that point and then lower your arms back down. As you start to recover, you will find that that range of motion increases. Now, when doing any of these exercises, I'm going to have you do 5 repetitions 5 times a day. And you should find that every time you do these exercises, you get a little bit more movement. As you're feeling much more comfortable, you can do these exercises in sitting, and that's much more functional. Okay, Louise, we're going to do these exercises in sitting, but before we start, I want to make sure that you get back into that nice posture that we taught you earlier. We're going to use a roll behind your back just to give you some more support. Now, the first exercise that we're going to do is called the chin tuck. And what I want you to do, just like we did in lying, is take your chin towards the center of your neck, very slowly. Good. Now let's do that again. Now Louise, what happened was you moved through the middle portion of your neck, and I want you to try and keep it stiff this time as we do it. And let's go again. Much better. I want you to hold it for a second, and then relax. As you found in lying, you should get a bit of a stretch at the back of your neck, or you'll feel that you're using some of the muscles in the front of your throat here. Okay? The second exercise that we're going to do is head rotation. And I just want you to turn your head towards the left shoulder to the point of where you're comfortable. You may feel some stretching along the right side of your neck or at the back of the left side. Hold it for a second and then come back towards me. Good. And then we're going to have you turn towards the right. Good. And here you may feel stretching on the left side or at the back of the right side of your neck. And just come back to the midline for me. Good. Now this is a different exercise, and this one is called side bending. And I want you to take your left ear towards your left shoulder without turning your head. Good. Now what you'll feel is a strong stretch coming in over on the right side of your neck. Hold it for a second or two, and then come back to the middle. And then I'm going to get you to come towards the right side. And again, it's normal to feel a strong stretch down the left side of your neck. And come back to the middle. The last exercise is we're going to repeat the arms overhead movement that we did lying down. So with straight elbows and in a good posture, I want you just to lift your arms up. Think of trying to keep the top of your shoulders relaxed, and just go to the point of where you have discomfort. Okay? And then allow yourself to come back down. Good. Like we did when you were lying down, we're going to do these exercises with 5 repetitions, 5 times a day. Doing them in the sitting position will allow you to do these exercises while you're at work. It will be normal for you to feel some discomfort after doing them. You can put some ice on your neck if you need to. If you experience discomfort lasting longer than 30 minutes, it means that you probably did just a little too much. So the next time you do them, just do a little bit less. But it is important to keep doing these exercises, as doing them will help speed up your recovery.
To review, the 4 simple exercises you've seen can be done lying down or sitting up, whichever is most comfortable for you. In the chin tuck exercise, you need to draw your chin down slightly and gently pull your head straight back. Think about trying to make a double chin. When doing a head rotation, keep your nose level and gently turn your head from side to side. To do the third exercise, side bending, look straight forward and tilt your head to bring your ear towards your shoulder. Finally, for the arms overhead exercise, straighten your arms in front of you and slowly lift them up as far as is comfortable. Eventually, you should be able to get your hands over your head. And remember to do 5 repetitions of each exercise 5 times a day.
Hi, Louise.
Hi.
It's been 3 weeks since the accident. How are you feeling?
Oh, much better now.
Oh, good. What have you been doing?
Well, I've been icing my neck for the first week, and I did my exercises. In the mornings now, I've been taking hot showers to loosen up my neck, and then again, I do my exercises. At work, I've been limiting my time on the computer and using headsets for the phone. I'm much more aware of my body now, and my body posture, I think, has improved. For the car, I've been limiting my driving. I've shared the car with a coworker, and when I get home, I have a cup of tea and relax and do my exercises again, and then in the evening I cuddle up with my pillows.
Have you been taking any pain medication?
Well, the first week I did take the prescriptive drugs that were prescribed to me, and now I've been taking over-the-counter medication, and I feel much better, and I'm improving, and I feel that I won't be using it anymore.
Sounds like you're going to be back to normal in no time.
Thanks.
The information presented in this program should be helpful to most people who've had neck injuries from a car accident. But if you're having new symptoms, or symptoms different from the ones we've talked about here, things like forgetfulness or a feeling of instability, you should see your family doctor for another examination.
And if you're still in constant pain or your symptoms are getting worse, again, call your doctor.
So remember, you will be okay, but you will be sore. This is normal. Use ice during the first few days. Apply it for 15 minutes at a time, and always use it after doing your exercises. Use pain medications if you need to. Try to get back to your regular activity as soon as possible. Watch your posture. And most importantly, do the exercises as shown. All it takes is 5 repetitions of each exercise 5 times a day. By following the tips in this program, you should look forward to a speedy recovery.